This is the news on PBCJ. I'm Carol Francis. It's Thursday, April 9, Holy Thursday, and it marks the beginning of the Easter weekend, one of the biggest holidays in the Christian world. Jamaicans normally celebrate by going to church, parties, and to the beach. Not this year, however. The advent of the COVID-19 pandemic will see these norms thrown aside in favor of anti-social measures to curb the spread of the virus. Speaking at a press conference on Wednesday, Prime Minister Andrew Holness announced new curfew hours for the holiday and beyond.
The virus can't move without us. The virus moves around when people move around. And so limiting the movement of people will limit the movement of the virus. During the Easter weekend, the curfew will be from Friday the 10th of April 2020 through Monday the 13th of April 2020. The curfew will commence at 3 p.m. in the afternoon and end at 7 a.m. the next morning. The new curfew rules after Easter, the new nightly curfew rules after Easter would be 9 p.m. starting on Tuesday to 5 a.m. Wednesday morning, continuing through to the 21st of April 2020.
Attorney General Marlene Malahoo Ford spoke to the closure of beaches and places of amusement.
The beaches are closed and the water facilities are also closed. And as the Prime Minister has said, it is to ensure that persons are not gathering and engaging in activities that will put them at risk of transmitting or contracting the COVID. So yes, the beaches are closed. That include the rivers and the waterfalls and all other water attractions. And be reminded that places of amusement remained closed as defined.
As of Thursday morning, Jamaica had 63 confirmed cases of COVID-19. with 4 recorded deaths. As health officials continue to do more testing, these figures are expected to change. The government received 23 crucial care ventilators and 6 mobile ventilators from the European Union. They will help ease the pressure on hospitals that may be caused by the coronavirus crisis. This is in addition to the 28 ventilators already in use on the island. More from Manon Samuels.
According to the World Health Organization, WHO, 1 in 6 persons becomes seriously ill with COVID-19, can develop breathing difficulties. In these severe cases, a ventilator offers the best chance of survival. The ventilator takes over the body's breathing process when the disease causes the lungs to fail. The ventilator is used to push air with increased levels of oxygen into the lungs. This gives the patient time to fight off the infection and recover.
This donation not only represents a significant part of the implementation of the plan that we have, but perhaps in terms of life-saving procedures, given that we do project that you will have a certain percentage of COVID-19 patients who will require assistance in breathing at the highest level of intensive care. This donation of about 1 million euros, 150 million Jamaican, represents the most significant in terms of saving lives. And as a consequence, I cannot overemphasize the thanks and the gratefulness on behalf of the government of Jamaica, the people of Jamaica, to the European Union for this contribution. It has effectively doubled our capacity in terms of ventilators in one major action, because as a country in our public health system, we had about 25 ventilators. Today, we're getting 23 and an additional 6 mobile. So we're actually getting more than we had in our public health systems.
Medical experts are projecting that at least 5% of COVID-19 patients could need a ventilator. Globally, there are not enough ventilators available in hospitals for all potential patients who will be struck by the virus. The donation will help Jamaica in its drive to having the projected amount of ventilators needed.
We did bring in more, so we have another 8 or 10 that we brought in over the last number of weeks and more to come. The ultimate goal is to have between 90 and 100, which would give us, based on the projections over the next year, of persons who will become sufficiently ill to require that high level of support. It would put us right in the zone, we think, where we would be comfortable and able to give that option to patients who need it.
Equipment is made in Ireland. Medtronic is the company that makes them. They're extremely high quality ventilators. It's brought by a contractor from Netherlands, SEDI Europe, together with Medical Link, a Jamaican company, experts in medical equipment. And we are extremely grateful to all of them to come together so well and bring this equipment here.
Reporting for the news on PBCJ, I am Marlon Samuels.
Despite logistics and sourcing challenges, Jamaica is now in possession of more vital equipment to aid in the fight against the coronavirus. Gabrielle Thompson tells us more in this report.
Ventilators, ICU beds, and over 595 masks. Minister of Health and Wellness Dr. Christopher Tufton says despite sourcing challenges, Jamaica now has access to equipment necessary to deal with the country's response to the COVID-19 coronavirus. Speaking Wednesday at a tour of the National Health Fund's warehouse, the health minister said the island now has a 3-month supply of critical items.
We have been able to access critical supplies like ventilators, monitors, ICU beds, stretchers. We brought in 500 N95 masks, which are very important for usage. We have a number of our temperature scanners and other critical items. So I think we're in a position now where we can safely say for the next 2 to 3 months, in terms of some of the very critical items, we have a critical supplies in storage.
Dr. Tufton says while the government arranges supply to healthcare providers, a second order of equipment is being prepared.
It's now to get that out to the hospitals and the health centers, and of course to manage usage. But in the meantime, we're now making arrangement for a second wave of order because we want to ensure that we do not have any shortages, any run out at all, because clearly we have to be ready to manage cases once those cases are determined.
China's response to COVID-19 has influenced other countries' rapid response to crisis. It has also reiterated Jamaica's relationship with international partners.
China is a big source market. As you know, the Chinese have had their fair issues of COVID, and they have produced a lot of items in response to that. And so they are the natural supply sources for a lot of the world. We have been able to tap into that network and gotten a lot. But some of it has come out of other markets also, out of Europe, ventilators, out of Ireland, and so on. So China would be a main market, but there are other markets also.
Also on Wednesday, 29 ventilators from the European Union were handed over to Dr. Tufton.
23 for bedside management in hospitals and 6 for mobile units, so in the ambulances and so on. Now, this is a very big deal. This is a cost of €1 million, and it has effectively doubled our capacity for ventilators in the country. As you know, for COVID patients who are very serious and have to be admitted into the ICU or high dependency units, they will require assistance to breathe, and the ventilators are a critical part of that.
For the news on PBCJ, I'm Gabrielle Thompson.
80 final year medical students from the University of the West Indies have joined the response team at the Ministry of Health and Wellness's Coronavirus COVID-19 call center. Minister of Health Dr. Christopher Tufton said he is pleased with the support from the university in the country's fight against the virus. Simone Absalom has the details.
The health minister visited the center where the medical students are making their own contribution to the country's COVID-19 response. Speaking at a digital press conference from the ministry's New Kingston location on Tuesday, Dr. Tufton thanked the students who have volunteered their time to the cause.
Well, I must say, I don't think we could have asked for better receivers of calls. I mean, you guys not only understand the jargon, you understand the different perspectives.
During the press conference, Principal of University of the West Indies, Professor Dale Webber, and Campus Registrar, Dr. Donovan Stanbury, signed a memorandum of understanding with the minister to reflect the partnership.
Their addition to the team means that we are in a position to better respond to the needs of Jamaicans who will call in, have been calling in, and sometimes because of the numbers of calls each day, each hour, we do get a little backlog. I'm really pleased that the Medical School of the University of the West Indies is now partnering with us to do this.
The call center numbers are 888-1-LOVE, that's 888-663-5683, or 888-754-7792, or 888-542-5998, or 876-542-6007, 876-542-6006, or 876-542-5998.
The emergency orders have been further amended to make it mandatory for certain at-risk individuals to wear masks in public at all times from April 8 to 21. Prime Minister Andrew Holness explained the reasoning behind the announcement at a press brief on Wednesday.
During the period from the 8th to the 21st of April 2020, persons are strongly encouraged to wear a mask that is fitted to cover the nose and mouth while in public places. This is not in the order, but we strongly recommend it. If you are going to go to the market, if you're going to take public transportation, if you have to go to somewhere where there would be a lot of people, not necessarily gathered in tents or crowded, but still a lot of people in that area, wear a mask. And we recommend that. We highly recommend that to the public.
The Prime Minister also amended the stay-at-home orders for seniors.
With effect from the 8th of April to the end of the 21st of April 2020, the following categories of persons shall remain at their place of residence, except that they may leave their premises once per day for food, medicine, exercise, and other necessities of life. Persons 70 years and over. You will recall that in the first set of orders, the stay-at-home order was targeted at persons 75 years and older.
At a time when the public is being urged to wear masks as an anti-COVID-19 strategy, young Jamaicans are doing their part through the HOPE program. They are mass-producing masks for distribution and are at the same time remaining safely engaged in meaningful work.
The program is a youth engagement program that was started by the Prime Minister back in 2017 with the intention to engage youth through training and apprenticeship. There was a huge need out there for people to be wearing face masks. As we know, the CDC in the US and the Chief Medical Officer in Jamaica is now starting to recommend that everybody, as they go into public spaces, to be wearing a mask. We wanted to stick with making the mask in Jamaican colors to inspire a sense of nationalism and patriotism as we start to give these masks out into the public.
We're working with the Bureau of Standards in order to ascertain the level of protection that these masks will be able to provide for our citizens, because we're very aware of the fact that they're not medical grade. However, any additional protection that can be provided by these masks to help with the prevention of COVID-19 is a plus.
I feel good coming out to help my nation with the fight against COVID-19?
I'm keeping safe by practicing social distance, always washing my hands, stay inside and using my mask.
I'd now like to put out a call for volunteers. Because of the need to ramp up production, I'm going to ask that if there is anybody that's out there who's willing to volunteer on the HOPE program, to come and to work with us to assist in making masks. I'm looking for persons who have prior experience in sewing, who really need to get as many masks made to get out to the public.
Starting today, Thursday, April 9, Jamaica-based individuals and businesses will be able to begin applying under the COVID-19 Allocation of Resources for Employees CARE program for benefits when the website goes live online. The program is being launched by the Government of Jamaica. This temporary cash transfer program is expected to assist with cushioning the economic impact that could be faced by individuals and businesses during the ongoing pandemic. Interested persons can apply on the website www.wecare.gov.jm. That's www.wecare.gov.jm. The plan was explained by Minister of Finance and the Public Service, Dr. Nigel Clark, at a press conference.
The program is geared towards the vulnerable population among individuals and the vulnerable among businesses that are affected by COVID-19. We do make for businesses that are in the tourism sector, we are aiming to have the program incentivize employers to keep their employees connected with their business, even if those employees are not coming to work, so that when the time comes to restart, Jamaica's recovery can be with the kind of momentum that puts us ahead of the rest of the region.
First responders will be allowed to ride free on Jamaica Urban Transit Company JUTC and Montego Bay Metro buses as the country grapples with the coronavirus. That measure was outlined in a statement from the Ministry of Transport. The first responders include doctors, all categories of nurses, interns, porters, hospital staff, firemen, private ambulance drivers, police officers and soldiers. The changes take effect immediately and will last until May 31, subject to review. Each person will be required to show a valid identification card to the driver in order to ride on the buses. 40 children in Montego Bay, St. James will benefit from a hot meal daily thanks to the Lee Antonio Foundation. The Lee Antonio Foundation is a non-profit organization founded by Montego Bay businessman Antonio McCoy.
I am Chenson Bennett, a representative of the Lee Antonios Foundation, also the campaign coordinator for the End Bullying Globally campaign. We just want to thank everybody for coming on board, answering the call to help feed 40 children in the Barnett Lane community and adjacent communities within Montego Bay. We have been blessed by persons who were willing to actually extend their numerous gifts and contributions to the children as we try to help feed 40 children 5 days a week, every week. I just want to extend a sincere thank you to everyone who have hopped on board, and we will be pressing forward as soon as possible to actually start feeding the children.
The charitable initiatives and programs of the Lee Antonio Foundation are designed to help and uplift underprivileged children, youths, and the elderly living in the inner cities of Montego Bay. On Wednesday, one of Jamaica's greatest actresses, Lloyd Kelly Miller, took her final bow, exiting stage left at the grand age of 102. She passed away in her Gordontown home in St. Andrew. Marlon Samuels reports on her tremendous contribution to the development of local theatre and work in film.
Lloyd Kelly Miller was a central figure in the development of Jamaica's pantomime. She performed in 13 pantomimes and is credited with co-writing 3 of the productions. Mrs. Kelly Miller had a number of leading roles, including Madame Serena in the Jamaican pantomime Queen's Daughter.
Magnificat!
She played the role of a dressmaker in Queen's Daughter alongside her friend Louise Bennett Coverley.
Me no understand me a go with you know. First you change your name from Ambrosina to Serena, and now you're going like you don't even remember me. Of course I remember you, Queen, but I just didn't want to wrong you this before the girl, you know. You don't know how feisty and ferocious these people are at work to do, you know. They love to heave up themselves, and I just asked to put them in their place. If they ever know that I born and grew up in Boller Lane with you, I'd never be able to hold up my head again. So that's why I was incognito to you. What a devil of a strain you under here. You see me here? I'm a living dichotomy. But it is worth it, my dear, because I'm very successful in my dressmaking saloon, you know. I sew for lots and lots of celebrities, my dear. Celebrities! That sounds like a bad sickness. But of course, you wouldn't understand the meaning of those words. But in my work, you know, I ask to use a little foreign language. Market. I don't understand the meaning of some of the words, them, you know. But I just drop a few here and there. Make them know that I can use them to comprehend for you. Lord, Ambro, I'm glad to see how you get up in the world, you see. When I remember them days when me and you used to box about them up on all. Let sleeping dogs die.
She also starred in the very first episode of the Jamaican sitcom Oliver at Large.
Ma? Donna?
No. Don't make a scene, Jane. Try to control yourself.
Is there a problem, Mother?
Listen, daughter.
Don't call her daughter. What if anyone should hear you calling my child your daughter? They may think that you and I... Paul!
If they don't want I man to stay.
Look, it's not only a matter of what they want. I live here as well. Well, for the time being, at any rate. Look, make yourself at home, Oliver.
Tell the truth, you know, Donna. I man don't feel welcome. But I used to get fight. I face a universal fight.
Jane, shake hands with the gentleman.
I man is delightfully pleased to encounter the eyes acquaintance.
Doesn't he speak English?
Let's see.
A consummate professional, she landed a role on the silver screen in her 70s. At that time, she appeared in the movie Meet Joe Black, which starred Brad Pitt and Anthony Hopkins.
You're a challenge to my great artistic talent. I should ask to furnish you with a basic garment. What is that? A girdle, dear. This corset, Mr. Weir. Get behind the screen and digress all your raiment. Really? Take off your clothes.
The veteran actress passed away on Wednesday morning at her Gardentown residence. She was 102 years old.
Let's join Gabrielle Thompson for the business report.
In Wednesday's trading session, the JUTC combined index advanced by 4,608 points to close at just under 400,000 units. Overall market activity resulted from trading in 84 stocks, of which 37 advanced, 31 declined, and 16 traded firm. The junior market index advanced by 3 points to close at under 3,000 units. Stocks advanced for 138 Student Living Jamaica, Barita Investments, and Caribbean Assurance Brokers Limited. Stocks declined for 1834 Investments, AMG Packaging and Paper, and Berger Paints Jamaica. Trading firm were Blue Power Group Limited, Darmon Trading Company, and Elite Diagnostic Limited. Trans-Jamaican Highway Limited was the volume leader with 10.3 million units, followed by Wigton Wind Farm Limited ordinary shares with over 3 million units, and Sagicor Select Funds Limited Financial with 2.5 million units. Now for the foreign exchange. The US dollar on Wednesday, April 8 ended trading at $138.94. The The Canadian dollar sold for an average $99.21. The pound sterling traded for $169.90, and the euro ended trading at $151.75. Tourists should see an increase at the pumps in the price of 90-octane gasoline and a decrease in the price of diesel effective Thursday, April 9, according to the latest ex-refinery costs from Petrojam. The price of 87-octane gasoline remains unchanged at $119.70, while 90-octane gasoline will be sold for $122.54 per liter, up by 3 cents. Automotive diesel fuel will be sold for $120.02 per liter, following a decrease of $3.06, while ultra-low sulfur is down $2.95 and will be sold for $125.04 per liter. Meanwhile, kerosene increased in price by 1 cent and will now be sold for $102.50 per liter. Propane liquid petroleum will be sold for $34.90 per liter, up by 1 cent, and butane liquid petroleum will be sold for $45.51 per liter after an increase of 5 cents. Marketing companies and retailers will add their respective markup to these prices. Oil prices rose on Thursday on expectations the world's leading crude producers will overcome obstacles at a meeting later on Thursday that have so far prevented a deal to cut output in response to a collapse in global demand. Brent crude futures were up 62 cents at $33.46 a barrel. West Texas Intermediate crude gained 80 cents to $25.89 a barrel. And that's it for the Business Report on PBCJ. I'm Gabrielle Thompson.
In regional news, private hospitals in Guyana may soon be able to test for COVID-19. This from Health Minister Walter Lawrence. InfoHub's Kellen Rover has the details.
Minister Lawrence explained that our ministry has already initiated the process of possible partnerships with private hospitals as the country tackles COVID-19.
Just a week or so ago, the CMO had the task to reach out to the private hospitals, not only about testing, but also about their facilities and whether they had the necessary space and equipment, etc., to be able to look at COVID cases. That has blossomed into several engagements with many of the private institutions. Today we addressed a few. There are some more to go.
Minister Lawrence also explained that it is not the view of the Ministry of Public Health that only GPHC should be testing for the novel coronavirus. However, the ministry is working with initial guidelines set by PAHO WHO.
As we recognize and we know that there are many Guyanese who wouldn't come to the public health sector, they go to their private physician, and that's their choice. And so we want to ensure that we can be able to work with the private entities to ensure that they can provide the services for their clientele.
The Public Health Ministry encourages all citizens to take advantage of an app launched which gives the opportunity to personally report any symptoms you may have related to COVID-19.
I now wish to enlighten you further on the use of this app. Its purpose is to strengthen the surveillance capacity for early identification of COVID-19 cases and to reduce the long wait for a response when using our hotlines. Your information will be reviewed by the surveillance department, and you would receive a call should you clinically meet the criteria of someone with COVID-19.
For InfoHub, I am Kellen Rover.
Over in Barbados, supermarkets remain busy as that country relaxes closure and curfew orders to allow citizens to restock necessary supplies. We take a close look with this report from Barbados Today.
A hive of activity for supermarket operators as they resume limited operations today for the first time since the curfew took effect last Friday. And for the most part, it appears the day went smooth. There was no in-store shopping as outlined by Acting Prime Minister Santia Bradshaw yesterday as part of measures to control the spread of COVID-19. Rather, shoppers were able to collect their pre-packaged groceries or online orders. Barbados today visited several outlets, including Chanel Supermarket in Black Rock, and store manager Mark Jordan says it was a busy day.
A majority of the orders has been called in, orders that has been called in. We are doing also some pre-packed orders as well. It has been a very busy morning and things is going pretty well. I believe that most customers are satisfied with the progress and how it's going. And I'm glad that we could be able to come here and do things a different way so as to satisfy everybody so that they can accomplish most of what they would need at this time. It's a very difficult period, and at the same time we want to practice all the safety measures put in place, and so that at the end of the day, we be quite satisfied with all that has been done. The orders is going pretty well. There's nothing much to complain about right now. It's just that it has been a very busy morning.
In sports, we are at the creases with cricket. Jamaican all-rounder Andre Russell has been named Wisden T20 Cricketer of the Year. In 2019, Russell scored 510 runs for the Kolkata Knight Riders in the Indian Premier League, while picking up 11 wickets, which won him the Most Valuable Player award. His tally of 52 sixes was 18 clear of another Jamaican, Chris Gale. And that's the news. On behalf of the entire production crew, we want to wish for you and your families a safe and holy Easter.